first is safety always. In the school evening of January, I feel immense pleasure to welcome you all to this motivational session. At any moment, you or someone around you could experience an injury or illness. Using basic first aid, you may be able to stop a minor problem from getting worse. In the case of serious medical emergency, you may even save a life. That is why it is so important to learn basic first aid skills. Today, our workshop is on first aid awareness. All are requested to mute your audios and videos. I request Tanvi Rakesh Kumar to deliver the welcome speech.
Good evening, one all. On this lovely and pleasant evening, myself, Tanvi Rakesh Kumar, on behalf of Pearl School, extend a gracious and warm welcome to our respected Principal Ma'am, our guest of honor, Dr. Romina, a well-known general physician from Naseem Al Rabi Medical Center, coordinators, teachers, and friends. As you all know, human beings experience a life filled with many hurdles, ups and downs, and weaknesses. To help with the health part, we have doctors. Today, we all have gathered here to gain some valuable information on first aid.
Thank you, Tanvi, for that informative speech. So now, please welcome Lali ma'am to the stage to introduce our guest for today.
Good evening, one and all. Respected Principal Ma'am, guests, parents, teachers, and students. It is my pleasure to be a part of this workshop. There is always a possibility for an accident at school or at any place. In such a situation, first aid prevents further complications. As we say, prevention is better than cure. If we follow a set of safety rules, we can eliminate possible accidents. This workshop is meant to train first aiders within the school and create awareness on safety rules. To take the session forward, we have a wonderful facilitator with us, Dr. Rumina Nazimuddin. She is practicing in Naseem Al Rabi Medical Center as general physician. Naseem Al Rabi Medical Center has been collaborating with Pearl School for the past 4 years. From free dental checkups for students to the COVID-19 awareness program and the recently conducted winter-related respiratory ailments and preventive measures workshop. It's my pleasure to have you here, Doctor. I now request Dr. Rumina to take over the session. Doctor, the screen is yours. Over to you.
Yes, thank you so much. Can everybody hear me? Can you hear me?
Yes.
Can somebody give me a confirmation if you can hear me?
Yes, we can hear you. We can see you also.
Okay, perfect. Okay. Good evening, one and all. Thank you so much for giving us the opportunity to conduct this first aid awareness program. And I'm very delighted to be a part of this program. Myself, I'm Dr. Romina Nizam, working in the Naseem Medical Center, Searing Road branch. I'm a general practitioner, and it's almost 1 year I'm working here now. Okay, so coming on to the topic, we will be discussing about first aid awareness. So to begin with, what is first aid? First aid means it's about taking an immediate action to help someone who has been in an accident or an injury, to help a child or an adult or a baby in the purpose of keeping someone alive or till the help arrives. So I'll be briefing about some of the points of the first aid, just like a general. So who is the father of first aid? I don't think most of us know about that. It is Mr. Frederick S. Mark, and he's the founder of modern first aid. Now, coming on to the 5 aims of first aid. What are the 5 aims of that we have to achieve while we give a first aid for people is, number one is to preserve life. Number two is to prevent the escalation of an injury or the severity of an injury. Number three is to promote recovery. Number four is pain relief. And number five is to protect the person from further danger because of the injury caused. First thing, what are the primary duties of a first aider? The primary duties of a first aider is to assess the situation quickly and calmly. The person who provides the first aid should always be quick, but also calm in the same time, because it's equally important to be quick and to be calm. My 2 points here, yeah? The second one is safety. We have to check if, first of all, we as the person who is giving the first aid is safe from our side, and also that we don't cause any danger to the casualty whom we are going to give the first aid to. The next thing is protecting yourself and them from danger. It's to prevent, next point is to prevent any infections between you and to the casualty, to promote comfort and reassurance, to assess the casualty and give first aid, to arrange for help if needed. Now, what are the most common medical emergencies that we come across in daily life, if it could be faced in school? Because since now we are speaking for a school setup, I would like to mention about certain things that happen in school, as well as in our general daily life, if we are going out, if we're facing any accidents, if we're going to the shopping mall, grocery, etc. So first thing that we commonly face is injuries, like cut injuries, braces, graces, or then coming on to sprains, any fits or epileptic seizures, if someone collapses, if there is a breathing difficulty, a heart attack, a stroke, or any severe pain. So I will be covering a few of these topics and giving a summed up a few points to brief upon. So first thing I would like to talk about is coming onto the contents of a first aid kit. What should we have in a first aid kit? There are many few things that should be available. Number one is, of course, a pair of gloves and a pair of eye protection, if we can provide. Then something which is called a CPR protect mask, which I will be mentioning about later, if in case we have to deliver a CPR to the people or to the casualty. It would be better these days, especially since the COVID is going on and everything. So it would be nice if we have a CPR protect mask. Then also, just as everybody knows about bandages, if it be crepe bandages, gauze bandages, then splints, elastic bandages, antibiotic ointments, antibiotic solutions, a pair of scissors, a pair of tweezers, and so on and so forth. So these are the most essential things that you should have in a first aid kit. Now I will tell about few things that has to be done in each scenario that we face. First thing I'll be covering about is, as I mentioned earlier, is a simple cut, a graze, or a bleeding, which could be minor or major. So cuts, as we all know, it usually happens with a sharp object. It could be anywhere in the body. So first, what we have to do is assess the depth of the cut. How deep is the cut? How severe is the cut? Is it involving, is it causing any exposure of muscles, soft tissues, or any bones? How deep is it? First, we have to assess. We have to calm the casualty and remove the casualty if the casualty is still exposed to any further harm. First, you check the surroundings, then you remove the casualty from the mode of danger. And then you have to wash your hands first with soap and water, and then approach the casualty. Wash the wound well with running water and soap if possible. Apply an antiseptic solution if the wound is minor. Of course, apply an antiseptic solution and an antibiotic ointment if you have it in your reach. If you have a first aid kit as well in your reach, you can apply the antibiotic ointment, and then apply a clean, sterile gauze around the wound. If it needs further medical attention, you can take the casualty to the hospital. Otherwise, it's okay. If you feel that the injury is minor and can be healed on its own with no medical attention, you can just leave it like that. Otherwise, you have to approach a medical care and seek for further medical attention if you're worried about any further infection or inflammations. So that's what you do generally when you have a cut or a graze or something which has caused bleeding in your body in any parts. Number two, yes, it's something called nosebleeds. We all are aware that nosebleeds, we usually use the word epistaxis in medical terms, which is used to refer to nose bleedings. And nowadays it's quite common. We see even children, we see babies and adults as well with nosebleeds. So, and there is a common myth. What usually we do with the casualty or advise the casualty regarding nosebleeds is that first thing is, of course, we have to pinch the nose with the soft part of the nose with the thumb and the forefinger. Pinch the nose, the outside part, which is the soft part, not the hard part or cartilage. Pinch the soft part with the index finger and the thumb and ask the person to lean forward. Lean forward and press and wait for at least 10 minutes. Apply pressure for 10 minutes and then release the pressure and reassess the bleeding. If the bleeding is still going on, of course, again, continue pressing and call the ambulance immediately. If the bleeding does not stop within 30 minutes, yes, you have to call the ambulance immediately. We say a time span of 30 minutes and a pinching of the nose with the thumb and index finger for 10 minutes at a stretch, release, reassess, again press, pinch the nose. The usual myth that is going on around this epistaxis or nosebleed is that some people, they ask the casualty to pinch the nose, but to lean backwards. But that is the most wrong thing or the wrong position that you can ask the casualty to do, because once you lean backwards, what happens is the blood from the nose, it flows down through the throat and passes to the esophagus. And there is even a chance for the casualty to choke on the blood and cause breathing difficulty and further even unconsciousness. So never ask the casualty to lean backwards. It's always lean forwards, pinch the nose with the index finger and the thumb finger in the soft part of the nose. And as I mentioned earlier, the 10 minutes, reassess, again 10 minutes, more than 30 minutes, call the ambulance immediately. So that's about nosebleeds and epistaxis. Number three, I would like to speak about any broken bones or dislocations, which we, of course, again, commonly come across. It could be either a sport injury, or it could be like a general fall during playtime or car accidents or anything. But as we all know, bone injuries are quite common. So bone fractures or bone injuries are of two types. One, it's an open fracture, and two, it's a closed fracture. So open fracture, as the word suggests itself, it says that the bone will be exposed to the outside of the body, outside the soft tissues. It will plunge outside the soft tissues and the bone will be exposed to the outside. And that's what is called open fracture. Closed fracture will be that there will be no visibility of the bone, but of course it is fractured in the inside of the body, and which could cause internal bleeding or hemorrhagic shock or anything of that sort. Can also happen in case of closed fracture. So fractures, if it is open or closed, should be managed both equally and in an emergency way. What are the symptoms of bone fractures, if it is open or closed as well? In closed, you can find there could be swelling, bruising, there could be difficulty in moving. The limb may look shorter, twisted, or bent, and there could also be a loss of strength of the affected limb, which has the open fracture or the closed fracture. If it is open fracture, the first aid measure that we have to do is, of course, cover the wound immediately, move the affected limb as little as possible, call the ambulance if the bone is sticking out or crooked, or if he or she is in severe pain. So as the first aid measures, what you have to do is move the affected limb as little as possible, allow the person to rest. If you can lie down the casualty, well and good enough. Call the ambulance immediately. If there is any bleeding, of course, control the bleeding, as I have mentioned earlier, like to apply pressure if you can. But if it is, of course, in the fractured area, you're not allowed to apply pressure. Just keep a clean gauze in the wound and call the ambulance immediately. Console and comfort the casualty as well. The next I'll be talking about is severe allergic reactions, which could be because of various reasons. Number one, because of any medicine intake. Number two, any kinds of food allergies. Or number three, it could be from any insect bites or stings. So food allergies or medicine allergies are usually present with common symptoms, which could be from a wide variety of causes. It could be like, wide variety of symptoms. So these symptoms could include from minor itching, redness of the skin, swelling of the lips, eyelids, the swelling of the throat, breathing difficulty, and so on and so forth. Even they can present with cough, nausea, vomiting, etc. So in case of severe allergic reactions, the first stage you can do is, if the patient is conscious and oriented and responding to you, of course, just console the patient. And if the patient has no breathing difficulties, just take the patient to a warm climate, avoid exposure to any more of the allergen. If it is dust or medicines, or even if it is insect bite, I'll come to that next point. But if it is severe, and if the person is experiencing breathing difficulties or unconsciousness or so on, if you have access to an epinephrine injection and you have a trained nurse near you, if it be in a school or if it's in an office, of course, every setup has their own medical facilities. So if there is availability of an epinephrine injection, and if the situation is hard, as I mentioned, unconsciousness, breathing difficulty, so on, you can administer the epinephrine injection in the presence of a trained nurse. Then next is about the insect bites. Insect bites, it could be from a wide variety of insects, which include wasps, scorpions, even scorpions, normal stings from usual flies or bugs that we see around. So the first aid that we can provide for bee stings, or these above mentioned things, are we have to move to a safe area to avoid the further bee stings. If needed, we can remove the stinger. If the stinger is still stuck to the person's skin, you can remove the stinger with a pair of tweezers. If you can use your hand, better. Tweezers, of course, if you have access to a tweezer, but never use any other foreign object like a wood piece or stem piece or anything else, because it could infect the bite later on. If there's a stinger, yes, remove the stinger. If there is not, wash the area with soap and water. Apply cool compresses. So this helps in reducing the pain and the swelling. Then apply any steroid creams or any calamine lotion if it is available again. And if the person is okay, as I mentioned earlier, with no breathing difficulties or no unconsciousness or anything, you can administer an antihistamine tablet if it is available. And usually the symptoms of bee stings or insect bites disappears within a matter of 24 to 48 hours. But in case if it is persisting beyond 24 to 48 hours, please seek medical attention. The next thing I would like to mention about is another situation which is not very commonly encountered, but still, of course, it could be encountered any time in our lives, which is about electrical shock injuries. Electrical shock injuries, what you can do, as we all know, it could be from any source of electricity, which could be from a high voltage electricity, or it could be from any kinds of switches which we encounter in our rooms, in our schools, offices, especially if we use wet hands. Doesn't mean that all switches will provide protection for us. So what do we do as a first aid? In electric shocks, never run to the casualty immediately. Make sure that the person has no more further contact with the electrical source. If the person is still in contact with the electrical source, what you have to do is, of course, take a material which is a non-conducting material, as we know, wood, plastic, or a cardboard. These three are the things that we can use, which is non-conducting, of course, and we have to move the person away from the source of electricity. First, move the person from the source of electricity, then we can do the rest of the first aid steps. If the person has got any burns, which has resulted from the electrical shock, it's not necessary that every casualty will get a physical burn on the skin. It could be even that there's just an internal injury or an external skin burn. Or even some people, if they have received an electric shock from high voltage sources, they can even end up with a cardiac arrest. That's the end point of what an electric shock can do to a person. But in cases of these minor ones, like as I mentioned, with just no superficial burns or with a superficial burn, take the casualty or move the casualty away from the electrical source first. Turn off the source if it is possible and if it is safe for you and it does not cause any danger. Try to turn the source off. If not, move the source away with a dry non-conducting object, as I mentioned. And if the person is okay, like breathing, conscious, alert, and oriented, you can just, if there is burns, treat the burns. If there is not, just if he's okay, just assess his breathing, his orientation and everything. And if he's okay, good enough. But if he's not okay, if he's unconscious, begin a CPR if needed. The CPR and everything I will be showing you later after the session. You can begin a CPR or of course call the ambulance immediately for further medical attention. Then some cases, yes, I'll be talking about eye injuries. We also encounter frequent eye injuries where even children or adults can encounter a foreign body inside their eyes. So what happens is the main tendency of a person is to start rubbing the eyes. When you have a foreign body inside, of course, you have a foreign body sensation, which causes itching and irritation and watering of your eye. But what you have to mention if you're around and you know the first aid for eye injuries or foreign body in the eye, never ask the person to scratch their eyes, because what happens is if there is a foreign body inside the eye, the more you scratch, the further damage you do to the cornea. So always ask the person not to scratch. And if you have a sterile gauze in access with you in your first aid kit, or if you are in any other place, if you do have a sterile gauze, cover the eye or patch the eye immediately and seek medical attention immediately. Don't ever try to take out the foreign body if you cannot. See, suppose it is like a hair, a simple hair or an eyelash, which of course most of us have encountered it in our lives. But if it is something more than that, if it is like a glass piece or if it is even dust, maybe you cannot see it, but it's causing severe irritation and foreign body sensation in your eyes, never attempt to take out the material yourself. As I mentioned, gauze or pad the eye with a sterile dressing and seek medical attention immediately. Next is burns. Yes. Burns, as we all know, there are so many degrees of burns: first degree, second degree, third and fourth degree. So usually first degree burns or second degree burns are the normal burns that we encounter in everyday life, which could be from some kind of a fire, probably from the kitchen or any other source which can cause a burning. Usually maybe even results in a blister, like we all know, fluid-filled small kind of blisters which happen on top of the injuries. So in burns, the first aid that what we can do ourselves is keep your affected limb or arm or whichever part of your body has been burned under running cool water, not cold, but cool water running for 20 minutes at least. All of us, what we tend to usually do is once we burn our hands, we run to the freezer, we take a piece of ice and just put it in for like 60 seconds. And then we're like, oh, wow, it's okay, it's done. But no, that's not what you have to do, because when you get a serious burn, you have to open the cool running water, place your hand or whichever affected part under running cool water for 20 minutes. That is the most important step that you can do in burning. I say the time frame, or usually everybody says the time frame of 20 minutes is that usually this heat could be trapped under your skin, because there are so many layers of the skin. So this heat could be trapped under the layers of skin. So even if the surface is cool, and as we think that when we apply, when our skin surface becomes cool, but still the heat is trapped under the lower layers of our skin. So that also could cause further tissue damage. So always see to it this time frame of 20 minutes is done under running cool tap water. And if there is a bleb, or if so, just apply an antibiotic ointment, apply a sterile dressing. And in case of severe burns, usually we say that seek medical help. And some people do, of course, need a TT shot and a course of antibiotics, especially if you are diabetic or hypertensive, or if you have any other comorbidities. It is also advised for seeking medical help if you have a severe bleb, or if there is any risk for rupture of the bleb and further infections. Then also, I didn't speak about sprains. Sorry, when I spoke about fractures, I forgot to mention about sprains. Of course, we do encounter sprains as well usually, like when we walk or when we do use heels, especially in case of women, but even in case of men, if it could be as part of sports injury, or it could be like when you're just walking, you tripped over a stone and you twisted your ankle. This is what is called sprain. The most common joint involved in sprain is the ankle joint. But also there are other joints which could be involved, like the knee joint, even the thumb, our hand thumb joint, thumb finger also could get sprained due to a sudden movement, which could result in the ligament sprain. So sprains usually is treated with the first aid. The first aid for sprain is that we have to apply ice. Ice is the first thing that you have to apply. Never apply ice directly over to the skin. Always use it as a pack and as an ice pack, or wrap it in a towel and keep it on the affected area for at least 15 to 20 minutes again. Ice helps in reducing the swelling and further injury to the joint or to the ligament. Never apply heat. This is also a myth regarding the ankle sprains or any sprains in any part of our body, that some people do apply heat. What happens when you apply heat? When you apply heat, this is usually for chronic conditions, because when we apply heat, the blood supply to the area is increased. So this increases the damage. It increases the further damage. We don't want the blood supply to be increased. We want the recovery. We want the inflammation to be reduced. That's why we tell the people to use ice packs. Never ice directly, always in ice packs, which is wrapped up in a towel or packeted. Use it for 20 minutes on the sprain area. Then some people, yes, also I have a topic regarding chipped tooth or knocked out tooth, like a broken tooth or a tooth that has come out. This could happen mainly in children, even in adults, like sports injuries or any other car accidents or so. So in case of chipped tooth, if the nerve is exposed, of course, you need immediate medical attention. But the place is, if the knocked out tooth, it can still be placed back into the socket, it is well and enough. Even if the child can hold the teeth back into the socket with the help of a gauze or a towel, it would be good. And then seek medical attention immediately. Of course, there's nothing much that you can do. If there is bleeding, apply ice, and if possible, keep the chipped or the knocked out tooth in its socket and seek medical attention immediately. The next thing I'm going to talk about is choking, which is, again, of course, a frequently encountered medical emergency when you eat, or if suppose a child who has ingested a foreign body, or if it's a child who doesn't have enough of advanced things, they could take these foreign objects and swallow, or even aspirate. They could put it into their nose. So this is choking in children. And in adults, it could be when they eat their food, or when they speak while they eat, and so on and so forth. There are so many reasons for that. So how do you recognize a choking? Choking is usually when a person has a difficulty in breathing or trouble in breathing, and they may hold their hands with the throat and they may gasp for air. This is when you identify that the person is undergoing choking. So what can you do to help a person who is choking? So there are various steps that you can do to help a person while they're choking. First, you have to, if the person is coughing, good, because the normal phenomenon of our body, of course, our body has a built-in defense mechanism. So when the person has a foreign body inside, the body itself tries to bring it out through coughing. So if the person is coughing, allow the person to cough. So if in case the foreign body is coming out, well and good enough. Otherwise, slap it out. We say slap it out. Like what happens is you have to go behind the person and use your, I will actually demonstrate that with a dummy. Just give me a minute. Gokul, can you help me with this dummy, please? Oh, no, my Mute, unmute. And more priority is the dummy. And if the dummies, this much part has to be exposed. Am I on mute, Google? But I need this much part of the dummy, huh? Because I need to demonstrate this. Okay, Mali. Can they see? Can they see me? I mean, not me, the dummy. Am I on mute? Did you unmute? Unmute? Okay. So this is the dummy. So I'll be just demonstrating in case of a choking. What happens is if the person has aspirated a foreign body, what you have to do is first, of course, check for breathing. And if the person, as I mentioned, is covering both his hands in the throat, what you have to do is take your hand and form a fist. Form a fist and place it between the breastbone and the navel. You have this part from the navel to the breastbone. Place your right hand, make a fist and place it right there. Use your left hand and make like forceful upward thrusts. 4 forceful upward thrusts, which means 1, 2, 3, 4, like that. Bend the person a little bit forward. Never keep the person straight. Bend the person a little forward. Use your right hand, make a fist, place it between the breastbone and the navel. Close your fist, apply pressure with your left hand, and give forceful upward thrust towards the diaphragm. This is the diaphragm. So 1, 2, 3, and 4. So you allow the person to cough it out, and you wait. And the first thing what I mentioned, this is called the Heimlich's maneuver. So before doing this, if you can, slap it out. As I mentioned, slap it out. For that, you have to again approach the person from the back, stand in the back of the person, help him to lean forward, use the heel of your palm, and this is the area that you have to do. As you know, we have 2 bones here, the backbone, which is the scapula. Use your heel, give it like this, 4 forceful thrusts. 1, 2, 3, and 4. And check if the person has spit it out. If not, repeat the same maneuver. If this is not helping, as I mentioned, the Heimlich's maneuver, fisted between the breastbone, left hand pressure, lean forward, 1, 2, 3, and 4. That's it. Okay, so that's what you do in case of choking. And still, if the person turns unconscious, or if the person has again trouble in breathing, then next what you have to do is CPR. So I will be showing you how to do a CPR. As all of you must be knowing the full form of CPR, it's cardiopulmonary resuscitation. So it is usually done in case when a patient does not breathe or does not respond, and you feel that the person has no pulse for some time. So this is what is called CPR. So first, what you have to do, first check the Google is, can they see the dummy? It's all good, right? Okay, so what you have to do is, of course, elevate, first check for any danger in the surrounding area. Always check for danger. If there's any objects around the casualty, remove the objects from around the casualty. Lift the head up and check for breathing. Check, feel, and listen. Listen if there is any breathing sounds. Look if there is any chest movements, and listen if there is any heartbeat. And with your hands, check the carotid pulse. Check for at least for 10 seconds. This is what we say. The usual time frame is 10 seconds. We check if there is any carotid pulse, and then you resume your CPR. So what you have to do in CPR, always keep the person's airway open. So never place the person's head straight to the body. Always tilt the head, keep the mouth open, and keep the chin like this. And how do we apply the chest compressions? Usually we give a chest compressions in the ratio of 30:2. 30 chest compressions followed by 2 rescue breathings. So how to give chest compressions? You have to place your right hand again in the breastbone, just below the breastbone, which is the sternum. Place your right hand like this, and with your left hand, you cover your right hand like this, and never flex your arm. It has to be straight. Can you, Gokul, can you just show the arm, the position of the arm? The arm of the patient arm of the person who does the CPR. It has to be straight. Your elbows should not be flexed. It should be straight because the force should be coming from your shoulder, not from your elbow. It's from the shoulder and your hands has to be placed exactly like this. And then you give 30 compressions each to 2 rescue breathings. So it's like 1, and you have to give in a form of that the thrust has to be at least the chest goes down by 5 centimeters. I know it sounds too much, but yes, this is according to the American Heart Association. This is what is the guidelines. The chest wall has to come down by at least 5 centimeters. So which means you have to exert so much of force. So you give the force from your shoulder, and it's like 1, 2, 3, 4, 5. You can see the chest wall coming down. You can see the chest wall coming down, rebounding up, down, up, down, up. You do that for 30 times. You go up like this, elevate the person's mouth, open mouth, and give 2 rescue breaths, which is like blow into the person's mouth for 1 second. Each blow has to last for 1 second. You give 2 breaths. Immediately continue with the CPR, again at the ratio of 30:2. 1, as I mentioned, with the thrust. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Like that, you have to do 3 sets. Again, tilt the person. Open the mouth, give 2 rescue breathings with your mouth, which each lasts for 1 second. This is and check for pulse and check if there is any response. And of course, before you do the CPR, always call the ambulance and do the CPR till the ambulance reaches. And these days, we also know there is something called the AED, which is the automatic external defibrillator, which is an automated machine which helps in applying a defibrillation, which is an external shock wave to resume the cardiac activity. So I believe that all of you must have got an idea of how to do first aid for choking, which is the slapping on the back, the Heimlich's maneuver, and also the CPR. Okay, now over to you guys. I hope this was a useful session. And yes, I would like to conclude my talk with this. If there is any questions, I'm ready to take them.
Thank you very much, Doctor. It was really informative. Now we shall start our question answer section. You can raise your virtual hand and you can clear your doubts. Laika, you can ask your question.
I have 3 questions. So I would like to ask a question. So the question.
Aparna?
Yes. Doctor, I have a doubt. Who
Yes,
can
yes,
do
tell me.
CPR? Who can do CPR?
Okay, that's a good question. Very good question. Who can do CPR? Basically, it's not everyone who can do a CPR. Only if you are trained and if you really know how to do it, that's when you have to attempt a CPR. If you don't really know and if you haven't taken a proper training session, never attempt a CPR, because it can even result in dangerous like further things which could be dangerous for the casualty. So if you are aware, if you have been trained, it's not like a training which lasts for like a month or so. It's just like you just need a 1-hour class for getting a proper training to do a CPR. Yes, that's my answer to your question. But never attempt if you have not been properly trained.
Okay. And are there any formal courses to teach CPR?
Yes, of course. There are a lot of online courses. There are a lot of in-person courses. Just Google which are the ones which is available in Qatar. And yes, of course, you do have, even we doctors, every 3 years, we have to undergo a training for the CPR and emergency services. We have to keep ourselves updated as well. So I believe, yes, there is courses for you as well. You can Google them up, which are the courses in Qatar, and you will get the sources for the same.
Thank you, Doctor.
Yes, you're welcome, my dear.
Farzin, you can ask your question.
Okay, ma'am. Ma'am, who should be given CPR, ma'am?
Farzin, yes, you're Farzin, right?
Yes, ma'am.
Yes, Farzeen. Okay, that's also a good question. CPR, as I mentioned, is given to only people who does not respond to you. Like you check if they're for their responsiveness. You make a clap, you call out their names, and if they're not responding to you, if you check their pulse, it could be faint. They will be unconscious. To such kind of people, you give CPR. Never give CPR to a person who is
Ma'am,
alert
I have one
and
more, ma'am.
conscious. Yeah, sure, go.
Ma'am, why is it dangerous to rub our eyes, ma'am? You told, right?
Yes. Is this Farzeen?
Yes, ma'am.
Yes, Farzeen. It's dangerous to rub your eyes because you can result. What happens is, of course, we all know that there will be an object inside the eyes. So when there is a foreign body or a foreign object inside your eyes, what happens is when you rub it externally with your hand, you tend to rub that foreign body all over your eye. So it can result in scratches in the cornea, which could even lead to further infections or even visual impairment. So that's why we say never rub your eyes in case of a foreign body.
Thank you, ma'am.
Welcome.
Ma'am, can I find out?
Yes.
When the tooth is too shaky and troublesome, can we pluck it?
I didn't get you. The Daksh Kumar, is that Daksh Kumar? Can you come
Yes,
again? I
ma'am.
didn't get you, Daksh. Can you repeat that again?
When the tooth is too shaky and troublesome, can we pluck it?
When the I didn't get you because you have a lot of background disturbance. So I just heard you. Can we pluck it? But I didn't get you what exactly your question is.
When the tooth is too shaky and troublesome, can we
Okay.
pluck it?
It depends on the age, Daksh. Who exactly do you mean? Is it pediatric age or is it adult age? Is it and what is the cause for the tooth to be shaky? Was it an accident or is it a normal tooth? Like as our deciduous tooth, we lose the deciduous tooth at the age of 7 to 9. So if it is in such kind of a case, it depends on the scenario, Daksh. If you would give me the scenario, I would let you know what to do.
Thank you, ma'am.
Yeah, sure, Daksh.
Aditi?
Yes, ma'am. Hello, can you hear me?
Yes, I can, Aditi. Yes, ask me, please.
Yes, ma'am. So if a person is having nosebleed, is it must or necessary to breathe through the mouth, and will it affect the nosebleed if we are breathing through the nose?
Okay, Aditi, that's a good question. Well, yes, if the person has a nosebleed, as I mentioned, do the maneuver, which is using the index and the thumb finger, pinching the nose, the soft part, and leaning forward, and of course, breathing through your mouth. Breathing through the mouth has no problem, and it is the maneuver that has to be followed.
Ma'am, will there be any side effects, like any dangerous effects if you breathe through the nose?
No, Aditi, of course not. There is no any dangerous effects while breathing through the mouth.
Okay, ma'am, thank you.
Welcome, Aditi.
Shikha?
Ma'am?
Yes?
Ma'am, I have a question.
Yes, Shikha, tell me, please.
Yes, ma'am. Ma'am, does our bone get affected or damaged when we twist our ankle?
Okay, Shikha Nair, yeah. Okay, good question, my dear Shikha. No, when you get a sprain, that is what we call a sprain, is usually a ligament injury. And what is a ligament? A ligament is usually a tissue which attaches your bone to the muscle. That is what a ligament is. So when a ligament gets slightly torn or inflamed, that's what you call a sprain. It's got nothing to do or not involved with any bones. So there could be no fractures, but of course it has to be assessed if there is any swelling or bruises, or if the patient or if the casualty is experiencing too much pain, he or she must undergo an X-ray to rule out if there is any bone injuries or fractures.
Okay, ma'am. Thank you.
Sure, you're welcome.
Ma'am,
Shikha.
ma'am, this is Sri
Yes.
Laksha. I'm having a question.
Yes, Sri Laksha, please ask me.
Ma'am, when you accidentally pluck a tooth, and that part where you plucked it starts bleeding a lot, what do we do?
Sri Laksha, why did you pluck your tooth in the first place? Did you try to pluck it? How old are you?
9.
9. Okay. So was it your permanent tooth or was it your temporary tooth that you tried to pluck out?
Ma'am, temporary.
Okay. Why did you try to pluck it out? Was it shaky enough?
Ma'am, I didn't try to like. I didn't try to. It was just too shaky. I was just touching it a little, and then
It came off.
then it automatically. Yes.
Okay. If it came off, it's okay. But if there is too much bleeding, you can keep ice packs, my dear, ice packs. And then if the bleeding does not stop, like after half an hour, you have to go see your dental doctor.
Okay.
Ma'am, I have a question.
Yes. Who is this? Sudarshana. Sudarshana, is that you?
Yes, ma'am.
Yes, Sudarshana. Tell me, please.
Ma'am, is that insect bites will be dangerous?
Sudarshana, insect bite depends on which insect has bitten you, my dear. If it is a honey bee, if it is a normal bee sting, it's not poisonous. But there are certain poisonous things which, like Scorpio, for example. But of course, you do not encounter Scorpios on your daily life. It's usually the normal honey bees or things that comes. It's not dangerous, provided it's not poisonous. It's not dangerous, my dear.
Ma'am, this is Aishwarya. Can Aishwarya ask the doubt?
Yes, Aishwarya, please tell me.
Ma'am, if our finger is totally broken, then what should we do? What first aid should we give?
Your finger. Can you ask me that again, Aishwarya?
If your finger is totally broken, and then what first aid can we give?
Your finger in the sense your finger in the hand or your finger in the feet?
Hand.
Hand. Okay. In the hand, how did you know it was broken? Like, did you see any symptoms, which was an inflammation, or if there was any redness, or it was severe pain that you could not bear? That's when you decide if it's a fracture or not, my dear. So can you tell me what would be the symptoms that
the hand, the finger, it went free, like it is totally broken.
Come again, Aishwarya, can you repeat that for me, please? Sorry, I didn't get you. Can you repeat that again?
Ma'am, when a hand totally breaks,
Okay. Totally, okay.
Then what first aid can we give?
Totally breaks in the sense if there is any bleeding, of course you can do the first aid for bleeding, and then you can splint your hand. Like if this part of your hand, you mean this part, like there is a fracture in your fingers, or this part, or if it is in the lower part, which is the forearm, what you can do is rest your arm against the shoulder and provide a splint, like a support. Basically, if there is a piece of cloth which is long enough, support your arm, cover it like this, and provide a splint, and go seek medical attention immediately, my dear.
Okay, ma'am, then how can we prevent nosebleeds?
How can you prevent nosebleeds? It depends on the cause, Aishwarya. It depends on the cause of what is the cause for your nosebleeds. Like if it is any recurrent sinusitis, recurrent infections, you have to get checked with your ENT specialist if you do have any polyps, or if there is any blood disorders, any platelet reactions, any clotting factors, bleeding factors. There are so many causes onto why your nose bleeds. So first you have to find out the cause. Not you, the doctor has to find out the cause and then treat the cause. That's how you do it, Aishwarya.
Okay, ma'am, that's it.
Okay.
Ma'am, has a doubt.
Yes, ask me, please.
Ma'am, you were telling about if we get shock burns or some shock